Because of this accumulation, right ventricle expansion has been limited, so it cannot expand. So if it does not expand, what's gonna happen? Not enough blood going into the system. So not enough blood going into the system. This will result in decrease blood pressure in the system, especially systolic pulse during inspiration. Why during inspiration? Because your thoracic pressure decreases during inspiration, which results in increased venous return. Increased venous return will result in what? So increased venous return right here, venous return, inferior vena cava, venous return comes here. It's gonna push the septum further over there. So your left ventricle, right ventricle and right atrium, they're going to push the septum over there. So your ventricle is already having hard time here. It's been not allowed to expand as much as it wants, and now you're pushing your septum even further over there because of increased venous return. This results in even lower ejection fraction, right? So decreased ejection fraction will result in pulsus paradoxus, which is again more than 10 millimeter drop in systolic pressure. Okay, now I'll explain something else as well. So what is pulsus alternan? So pulsal alternan, it refers to, look at its name, pulse alternates when, right, beat to beat, so beat to beat there is going to be pulse change. Why would it happen? It will happen because of change in systolic blood pressure, and when it will happen, left ventricular dysfunction again. Listen, electrical alternate is like a pericardial effusion or cardiac tamponade issue again, because you know when you have, this is your heart, so when your heart is in this fluid, heart is pretty much swinging. So when it swings, it cannot function as it wants to do it. So that will result in change in amplitude due to change in systolic pressure. So It is commonly seen in patients with left ventricular dysfunction. Left ventricular dysfunction, again, the situation, pathophysiology I sort of explained earlier. You have fluid, not letting it expand as much. So each time the beat is differently beating. Now I'll explain one more thing. Hyperkinetic pulse. Hyperkinetic pulse. So what is hyper and what is kinetics of pulse? Okay, hyperkinetics of pulse. It's basically rapidly rising pulse with high amplitude. Rapidly hyperkinetic, rapid, right? Fast. Rise in pulse with high amplitude. So why would it happen? Because there will be rapid ejection. When will you have rapid ejection? When there is more blood in the heart, or when there is less blood in the heart? This is my question. Think about it. Answer fast. This can happen in when there is more blood, because Frank Starling, increase blood, increase contraction. So you have a situation like aortic regurgitation. You'll have more blood, usually left ventricle. This is your heart. Right atrium. So what happens? Usually left ventricular output is what? So end diastolic volume is like 120 and systolic volume 50. 120 minus 50 is 70, so you'll expand 70. But then if it's aortic regurgitation, blood comes back, some of it, and then there is more blood coming from left atrium, and then there is blood coming back from here. So it's going to be rapidly fill the left ventricle. Faster the left ventricle fills, more blood inside it is, the rapidly and harder or strongly it's going to contract. So next time more blood goes out. Instead of 70, might be 18 going up. 80 millimeter of mercury, 80 ml of blood is actually going outside. Not the pressure, the volume is going to be more. Okay, obviously pressure is going to be more too, but I'm talking in terms of volume. So more blood going out. So hyperkinetic means rapid rise in pulse with high amplitude. Why high amplitude? Because next time more, instead of 70, you have 80 ml of blood is going outside rapidly, because more blood, left ventricle fills faster, so it sends blood out more faster. So hyperkinetic pulse, rapid rise in pulse with high amplitude. Frank Starling, think of more blood, aortic regurgitation bringing more blood. So in this situation you have hyperkinetic pulse. One last thing, sorry. Okay, so I want to explain about what happened in aortic stenosis. Aortic stenosis, what happens? You have obstruction of outflow of blood from left ventricle to the system. What will it cause? This term really bothered me in school too. Pulsus, parvus, Pulsus parvus at tardus. Think of it tardy, slow. Pulsus parvus. Parvus, think of parvus as like low rising, low amplitude. Low amplitude. So low amplitude, slow rising. So aortic stenosis, why would you have low amplitude and slow rising? So think of it. This is your heart contracting and then blood goes out. Okay, so 0.0, 0.2, 0.4, so 0.6. Now if it's slowly rising and not even rising as much, and then at the same time it's taking longer and not even high amplitude, so 0.0, 0.0, 0.2, you have like half of the ventricle ejected at this time. Still gotta do more, right? So at 0.4 second you finished almost like 1.25 of the ejection. So you had like in almost 6 seconds you had 2 beats. So slowly rising and at the same time slowly rising and low amplitude pulses parvus at tardus. So why would you have pulsus parvus at tardus? It's a slowly rising low amplitude pulse due to diminished stroke volume. Why you have to diminish stroke volume? So left ventricle stenosed. You think more blood going or less blood? There's obstruction, so less ejection fraction. Instead of 120 and diastolic volume minus 50 and systolic volume equal to stroke volume, which is 70. 70 is not going this time because of stenosed. If 70 needs to go, it has to do more. It takes longer because it's a smaller diameter of the valve, aortic valve. Okay, because it's stenosed. Aortic stenosis is going to take more time to pass the same amount of blood. And think about it in this term. So it's the diminished stroke volume, decrease aortic stenosis, decreased stroke volume, and prolonged ejection time. Pulsus parvus at tardus. Pulsus parvus, think of increase time, decrease amplitude. Honestly, I feel like seems like it's increase amplitude because it's stenosed valve, so heart has to do more. But the way I learned, I believe it's low amplitude and high time. So pulsus parvus is problem with your obstruction with your left ventricular outflow, which leads to low amplitude and slowly rising pulses. I hope it helps. Thank you so much. Have a nice day.